Today I'm going to discuss with you schizophrenia. I'll define the disorder, go through some of the common causes, signs and symptoms, and treatment options, among other things. To define the disorder, it's a disorder of the brain, a psychological disorder characterized by disorganized behaviors, thoughts, and perceptions. Emil Kraepelin was the first to try to define the disorder. He called it dementia praecox. He believed that it was a brain disorder that characterized by early onset and inevitable decline. Later, Eugene Buehler coined the term schizophrenia. He believed it used a combination of the Greek words split and mind, because he believed it was a lack of connection between behaviors and thoughts. Concepts on the etiology. The early views were characterized by the psychoanalytical theory of the time. It was believed that schizophrenia was a type of psychotic reaction or a fragmented or damaged ego due to rejection. However, views have changed. In the 20th century, there became a major focus on the brain chemistry. And along with that, scientists developed medications that could affect or alter the abnormal brain chemistry to try to treat some of the symptoms. Buehler's 4 A's of schizophrenia. These were used as the criteria for the DSM-1 and DSM-2. However, they were critiqued or criticized for being vague. These 4 A's consisted of autistic thoughts. Individuals with this disorder may be socially withdrawn, affective incongruity, they may smile or laugh while talking about a sad subject, loose associations, just disorganized thoughts or lack of logic, ambivalence, they may develop conflicting ideas. Next, Schneider defined the 4 symptoms. First-rank symptoms. Delusional perception. Individuals with this disorder may interpret things bizarrely. They may have auditory hallucinations, hear things that are not really there. Disturbance of thinking. They may broadcast their thoughts or actually withdraw them. And they may have some passivity phenomenon where they believe someone else is in control of them. However, this was critiqued for only displaying the positive symptoms of the disorder, when there are actually negative symptoms and cognitive impairments. So some of the positive symptoms of schizophrenia: they have abnormal behaviors, thoughts, and feelings. These are feelings and thoughts that are present in schizophrenic individuals but not in the common public. Examples of these signs and symptoms: catatonia. Individuals may be awake but unresponsive, so if you come up to them and are talking to them, they may not acknowledge you. They also display waxy flexibility, so if you were to manipulate their arm, they would keep it rigid in that place without moving it. Some of the negative signs and symptoms, their behaviors, thoughts, and feelings that are present in the normal people but not present in schizophrenic individuals. Examples of this include anhedonia, which is a decreased capacity for pleasure; avolition, decreased ability to make or keep plans; and allogia, which is a decreased quantity or quality of speech. Some of the cognitive impairments include inattentiveness, decreased processing ability, and ekacholia, which is decreased or repeating words that they hear someone else say. The cognitive impairments are typically the first signs and symptoms to present themselves. Disease characteristics: it has an early onset, typically early adolescence or late adulthood. It's chronic in nature with periods of remission followed by periods of relapse. Symptoms usually stay stable throughout the disease process. Prognosis is usually poor. The earlier the onset, the worse the prognosis. This just displays the DSM-5 criteria. As you can see, individuals to be diagnosed must have 2 of the signs and symptoms listed, and one of them must be a positive sign and symptom for at least a period of a month. There's other criteria involved for diagnosis. Changes in diagnostic criteria over the years, the DSM-5, between the DSM-4 and DSM-5. The DSM-5 requires that 2 signs and symptoms be present, instead of the DSM-4 only required 1 sign and symptom. The DSM-5 also specifies that one of the signs and symptoms that's present must be positive. This has made increased diagnosis reliability and decreased misdiagnosis with the more rigid standards. Prevalence and incidence, more common in men. However, schizophrenia, if it develops in women, it typically develops later, which leads to a better prognosis or a more mild form of the disorder. There are no symptomatological differences between ethnic and racial groups. However, African Americans have an increased diagnosis rate compared to whites and Latinos. The overall lifetime prevalence of the disorder is 1%. Disease-associated costs, there are many. It's a very expensive disorder. They can be functional, financial, social, occupational, or time-oriented in nature. There's also the cost of comorbidities, including anxiety and depression. These individuals often have decreased functional ability. They're not able to do the activities of daily living, so they have to have a babysitter or someone keeping an eye on them at times. Financial costs, medications are expensive. This puts a big strain on families. These individuals also have trouble developing social relationships due to their diminished social skills. They have trouble making friends, and especially romantic relationships are very hard. Occupational wise, they have trouble landing and keeping a job. Just to put things in perspective, one of the highest debilitating conditions, and schizophrenia in 2002 was estimated to cost about $62.7 billion. Causes, not really fully understood. However, there are certain factors that scientists assume play a role or suspect to play a role in the disorder. Neurotransmitter abnormalities have been consistent. Dopamine levels, elevated levels in the limbic region have been known to cause positive signs and symptoms of the disorder. Decreased dopamine levels in the cortical region have been noted to cause some of the negative signs and symptoms. And deficits in GABA and the glutamate have been linked to cognitive impairments. Certain genes place individuals at increased risk and have been associated with the disease. Exposure to lead or influenza during pregnancy, and then overcritical and over-involved families increase the patient's risk for relapse and hospital readmission. Some of the treatment options, pharmacologically is the biggest one. Initially, typical antipsychotics were used. However, they only treat the positive signs and symptoms, and they have some serious side effects. Atypical antipsychotics treat the positive and negative symptoms as well as some of the cognitive impairments, and they have less serious side effects, and that now has become the top treatment of choice. There are some other options, psychosocial treatment, such as psychoeducation, where family and the patient are just educated on the disease so they are more comfortable with it, know what to expect. Cognitive behavior therapy, CBT, is self-examination. They look at their own viewpoint on the disease and themselves. Some social skills training, supported employment. Therapists may meet with an individual, help them search for a job, and meet with them throughout their employment to help them keep the job and just develop good skills. Overall schizophrenia, it's a disorder of the brain characterized by disorganized thoughts, speech, and behaviors. There are many possible causes scientists believe can affect the disorder. Very high costs, and there are multiple treatment options.